Today I'm absolutely delighted to talk to you about the Accelerated National Innovation Adoption Pathway, also known as ANIA. It's a brand new and exciting new initiative for NHS Scotland. We do have this phenomenal innovation ecosystem. We're really lucky in NHS Scotland. However, what we do find is that those innovations don't often make it through to the front line, into the hands of our patients and our clinicians and our frontline teams. ANIA is an opportunity to think differently about that, and it's an opportunity to think about our challenges within the NHS, but also think about that alignment of innovation. This is delivered through a vehicle called the ANIA Collaborative, which comprises of a number of our national health boards and Scottish Government divisions across NHS Scotland. In addition to that, the Centre for Sustainable Delivery is a key component of it. So within the Centre, we are responsible for the leadership and coordination of that pathway and accountable for making sure that these innovations flow through. We also bring significant clinical leadership through our specialty delivery groups, and we know that in order to be able to get innovations into the services, it's important that the clinicians A, feel they need it, and B, that it actually solves the problems that they want.
I'm very keen to support the work of ANIA in bringing fast adoption of new innovations that work in one place in Scotland, post-evaluation to be rolled out across Scotland. We need an end-to-end innovation system. We've got really good research. We're amongst the best in the world for producing research that is valid to develop good ideas into new solutions. We're doing very well now with the regional test beds in taking those solutions with industry to the first adoption. The work of ANIA, though, is to support that rapid development across Scotland. And with that, Scotland will work collaboratively to find the business cases and the key operating models to make those innovations work in new area.
We are delighted that Digital Health and Care is a key partner in the ANIA Collaborative. We have seen lots of digital and technology developments over the years, but there has been a challenge with scale-up and adoption. So the opportunity with the ANIA Collaborative is to create the conditions to ensure that both the work at national level and in particular to support the local health and care delivery partners is provided to facilitate the evidence-based innovation and technology developments to enable those improved outcomes for our citizens and more efficient and cost-effective services.
Our Research Development Innovation, or RDI office, provides a range of services covering the complete RDI life cycle. We help innovators navigate the health and care landscape in Scotland, we build and manage infrastructure for innovation, and we provide national subject matter expertise to inform and enable sustainable innovative solutions. As an ANIA partner, we bring two further key services to this vital collaboration. Firstly, as potential solutions emerge, there is a need to understand the gap between what has been developed for evaluation purposes and what is required to achieve and sustain national adoption. We have developed a service adoption readiness toolkit, and working with other partners, we identify any gaps and feed these into a value case to allow for a fully informed decision to be made. And finally, following a positive value case decision, our national project and change delivery experts work with health boards and suppliers to achieve implementation and adoption of the solution so that value and benefits can be realised.
Public Health Scotland provide the best evidence to help inform decisions and spending on innovative interventions and services that can affect health and well-being. We generate evidence contributing to the understanding of how to prevent illness and improve health and well-being in Scotland. This includes provision of data and intelligence to key partners to enable people to innovate, design and plan quality care and services. PHS continues to develop and improve the quality of and linkages between different sets of data to offer vital intelligence to our partners, including ANIA. This will inform each decision point in the ANIA pathway to help improve the health and well-being of Scotland's communities.
I'm delighted to talk to you today about our role within ANIA. NES is the national NHS body with responsibility for workforce development, education and training, and is a leader in education design and delivery. We work collaboratively with ANIA partners to ensure a strategic workforce development approach through, for example, workforce and skills analysis, planning to support service design and innovation, including new approaches, models and locations of care. By working with ANIA, innovation can be a key enabler of sustaining skilled, capable and adaptable workforce, delivering services and improving outcomes for people.
Healthcare Improvement Scotland is delighted to be a key partner in the ANIA Collaborative. We know that the COVID pandemic has had a significant impact on our health and care system, and that its recovery will depend in part on our ability to identify the high impact productive innovations and then to implement these at pace. The ANIA Collaborative has a critical role to play here. It will help us as a country to understand what those high impact innovations are, and Healthcare Improvement Scottish Health Technologies Group will play a key role here in understanding the impact of innovation. The ANIA Collaborative will also provide support for implementation, and Healthcare Improvement Scotland's iHub will play a role here in providing advice on the most effective spread methodologies, and it will also provide support around ensuring that the implementation infrastructures are in place across NHS boards and health and social care partnerships. We're looking forward to working with all our partners across Scotland to ensure that we identify and implement the innovations that will have a significant impact on the outcomes for our population.
So it's a really, really exciting initiative. It's a way to think differently about the delivery of care for NHS Scotland, and I'm really, really excited to work with colleagues across NHS Scotland to think differently about how we deliver services in the future. Thank you very much.